this isn't live on YouTube. I could be streaming, but I don't want to. So I'm going to be recording here.
You're gonna edit too, right?
No,
Or
so this is
strictly
just
live?
conversation.
Okay.
In order to get it up, it's
Okay.
just a second. I gotta hit record here. Yeah. Oops. Oh wait, 1 second. I forgot that I already finalized this. I gotta do a new disk. That's okay. We'll take a second for this to. You guys don't bring me up in this, as I said in the text. This isn't about self-promotion for me at this time, okay?
So I can't thank you for doing this?
Well, at least not the funeral, just
Tom Murphy,
television.
right?
Because this is not time for me to self-promote. I'm just trying to be part of the solution here. And Rob, Doc, if you guys look at the cameras, these are the shots. There's Doc. I can go in a little bit tighter. And here's Rob. There we go. Let me go in a little bit tighter and Doc.
There's like a 3 or 4 second delay. It's kind of cool.
It is, because that's cool. We're live and it's digital, and so it takes a second. I see it instantly, but there we go. The other thing is breathe deep and relax. In 3, and 2, and 1, you guys are on.
Hi, this is Kim Gonzalez, the Public Health Director for Los Animas County's District Health Department. I would like to thank Tom Murphy for allowing us to have this video conversation today and air it on YouTube and other streaming channels. We really appreciate the help with getting the media out there. Going forward, I'd like to have my 2 colleagues next to me introduce themselves.
I'm Rob Bookvac. I am the Emergency Preparedness Coordinator for Los Animas and Huerfano counties.
I'm Dr. Abigail Norris. I'm a family practitioner at Mount San Rafael. I'm also the medical director at Los Animas and Huerfano Health Department.
And so today we are just going to inform the public on some information on what public health has actually been doing between the 2 counties. We are a bi-county health department, so we do serve both Los Animas and Huerfano County. Going forward, I would like to let everybody know that as of March 27th, currently Los Animas County has 0 cases of coronavirus. They have tested 39 patients. They have 36 negative tests that come in and are awaiting 3 tests for Los Animas. Huerfano County does have a confirmed positive case of coronavirus. The Spanish Peaks Regional Health Center has tested 7 patients. They have 5 negatives, 1 positive, and 1 pending at this time. For the case summary for the whole state of Colorado, Colorado does have 1,430 cases, 184 hospitalized, 39 counties affected, and 10,122 patients have been tested. Colorado does have 24 deaths and 9 outbreaks in residential and non-hospital healthcare systems. I do want to make sure that due to the nature of this programming, it will be streaming on multiple channels at different times. That is as of 3/27/2020. Going forward with public health, I just want to reinforce that public health does have the stay-at-home order. We are following and enforcing what the governor has pushed out, which is March 26th through April 11th. We are asking that all Colorado and Los Animas and Huerfano County residents stay home at this time. It is very critical that we try and reduce the epi curve and slow the spread of coronavirus. Going forward, I'm going to ask a few questions of my 2 colleagues. so that you can kind of understand coronavirus and what public health is doing on the backside. So Dr. Norris, can you tell us what the COVID-19 signs and symptoms are?
The most common signs and symptoms are fever, dry cough, and shortness of breath. Other symptoms that are similar to what one would have with a cold or with allergies can include runny, stuffy nose, sore throat, and in rare cases, GI symptoms such as abdominal pain, nausea, or vomiting. But the three symptoms that one should be most on the lookout for are fever, dry cough, and shortness of breath.
And Rob, what should someone do if they feel they have symptoms of COVID-19?
Well, if they have mild to moderate symptoms and they feel like that they don't need medical care, they should just self-quarantine at home, stay at home. If they do feel like they need medical care, they need to call their provider first and get screened over the phone. If they decide they need to go to the hospital, then when you call for EMS, you should let the dispatcher know that you do have the symptoms, and EMS personnel will take the appropriate precautions, and also let the hospital know that we're bringing in a patient. And that's pretty much it. But if you have mild symptoms, you don't need medical care, just self-isolate at home, quarantine, and just essentially stay home for 14 days. And I believe the other guidance is at least 7 days from the time the symptoms start, and 3 days with no fever without having taken any non-steroidal like Tylenol or aspirin or Motrin or anything.
Thank you. And Dr. Norris, is there any treatment for coronavirus at this time?
Treatment at this time is largely supportive, which means fluids, rest, hydration, and medications to help with breathing. Most of those can be done at home if the symptoms are mild, under the close monitoring of somebody's medical professional. One thing to note is that people should avoid ibuprofen and related products. In some cases, that has been shown to possibly worsen the symptoms. So if something is needed for pain or for fever, use Tylenol instead. The treatments that are under investigation right now and have been getting a lot of publicity are the hydroxychloroquine and chloroquine, so the brand name Plaquenil, used for a lot of autoimmune conditions and malaria. They are under investigation right now. In some cases and in some countries, they're being used experimentally, but they do have possible risks that are significant, so they're not currently FDA approved for COVID treatment. The cases where you'll see them used are very severe hospitalized cases where it's kind of a last-ditch effort.
And Rob, how should people or should people not wear PPE, mask, gloves to prevent themselves from coronavirus?
Only healthcare workers in a healthcare situation definitely need PPE. We see a lot of people out in the stores wearing masks and gloves and those kinds of things. I think, and Dr. Norris can correct me if I'm wrong, but that's kind of not necessary. That with good social distancing, hand washing, and those things, that should be adequate. You really don't need to wear those that PPE out in public. The other reason for not wearing it out in public is we want to conserve as much as we can. So when you're wearing it and it's not necessary, essentially we're using up PPE that we don't need to be using up.
Yeah, I agree with that. The issue is the shortage of PPE. In some cases, healthcare workers are using it and they're rationed to, for example, one mask to use for a whole month. And it's a disposable mask, so they have to find a way to, pseudo-sterilize it and keep using it. And so that's the reason why it's most prudent to use the PPE when you're either exposed or experiencing symptoms. And as Rob said, in other cases, the best thing to do is follow the social distancing and isolation or quarantine protocols.
And Rob, what is the health department currently doing with regard to acquiring PPE for healthcare nursing home, those that fall into the guidelines of using proper PPE?
Okay, so we're assisting with agencies in obtaining PPE, whether it's ordering it through the Emergency Operations Center, or we're getting pushes of PPE through the Strategic National Stockpile. However, the Assistant Secretary for Preparedness and Response is requesting that all that PPE that comes through the SNS goes to healthcare workers, and it also goes to any healthcare worker that's in a potentially hazardous situation, such as nursing homes or clinics, or people that treat patients, right off the street kind of thing. EMS is another big consumer of PPE, and so those are the ones that generally get the SNS stockpile.
And Dr. Norris, what should people do if they feel they have come in contact with somebody who is positive for coronavirus?
The first thing is to stay home, and you can call your medical provider for further guidance. With the limitations in testing supplies, one wouldn't be tested unless they're experiencing symptoms or have greater risk factors for severe illness. The number one thing to do is call their medical provider. If they experience mild symptoms, then again, as Rob said, stay home. Just be in close contact with your primary care provider.
And what should someone do if they are experiencing a medical emergency?
Call 911 or go to the emergency room. Symptoms of a medical emergency or severe illness would be trouble catching one's breath, so one just can't breathe. Very high fever that's not coming down with Tylenol. Altered mental status, confusion, or chest tightness, chest pressure.
And Rob, can you tell us the importance of social distancing, limiting social contact?
Well, the importance is to stop the spread, obviously. You want to stay at least 6 feet away. I believe the recommendation is the droplets, I've been told, I haven't seen anything, can remain in the air, airborne for up to 3 hours, and on surfaces for up to 9. So, the further away you are from somebody who potentially could be infected, the less likely you are to be infected as well.
Thank you. Lastly, I would like to just go back to the beginning of the stay-at-home order with the governor. The purpose of this stay-at-home order is to flatten the curve and decrease the amount of cases of hospitalizations and cases across our 2 counties or across the state, including the nation. As you all are aware, at this time, the U.S. is the #1 country leading the number of cases for COVID-19. Based on the global 2019 rates, hospitalizations, deaths of public health experts predict, without measures like the stay-at-home order, Colorado hospitals will be unable to handle the surge of sick people, and in many states they could die. Even these extreme measures, hospitals are likely to reach the maximum capacity to care for people they serve with the symptoms. The stay-at-home order aims to slow the rate of the virus, giving our healthcare emergency management systems additional time to grow the capacity to get the PPE needed. We are asking that all Los Animas-Huerfano County residents stay home and follow the governor's orders. We are holding daily briefing calls at 10 a.m. with all local emergency partners between the 2 counties. At that time, we give updates and guidance that comes out daily, hourly, between CDPHE, Colorado Department of Public Health and Environment, and Governor Jared Polis. We are monitoring all reports of possible exposures, following up on isolation and quarantine orders. the public health nurse is following and tracking guidelines as needed between Los Animas and Huerfano County. We are in constant communication with Spanish Peaks Regional Health Center and Mount San Rafael. We are continuing to follow the guidance coming down from Colorado Department of Public Health and Environment, as well as the governor, in implementing this guidance and orders between the two counties. Los Animas Huerfano County's District Health Department is working to limit and slow the potential spread of the disease, and all community members can help. We advise you to stay informed with the reliable information and take everyday actions to protect yourself, your loved ones, and for those you care for, your neighbors, your coworkers, especially people that are high risk. You can reach more information on our health department website at www.colorado.gov/LA-health, or you can call CoHelp for non-emergency medical questions at 877-462-2911. There is also another resource through Colorado Department of Public Health and Environment. Their website is covid19.colorado.gov. And we thank you for listening to the Health Department, Dr. Abigail Norris, the Medical Director, Rob Bukovac, our Emergency Preparedness Coordinator, and myself, Kim Gonzalez.